Hi, everybody. Oh, there's Kayla. Okay.
Hello.
Hello. Hello.
I do believe that Commissioner Glenn is on as well. I see his office number on there. So I think we're all here if we're ready to start.
I think so. Is Colleen, do you have everybody you need here present? Or expected to be here? Do you have everybody you expected to be here in the meeting? Can you see?
I can't see if Lisa's on yet.
That's
Dr.
what
Lisa.
I'm wondering about. Do we know who O2, who's O2? Oh, that's Public Works. Okay. And 1373, 1628. Can you identify yourself?
1628 is me, Sarah Michael Irwin.
Oh, that's you. Okay. Are you
I'm
on?
headed
Are
back to
you?
the office, so
Gotcha. Okay. Thanks, Michael. Oh, 259 is Mabel. Thank you. This is Patty. So it looks like we need to wait for Lisa.
Yeah, I can text her. So as many of you might be aware, I also invited our Board of Health members. So I do see that Cornelia Patty is on this call as well. Looks like she's iPhone Cornelia, if you're wondering who that is. And so the only other people from Board of Health would be, because obviously both Kayla and Mark are on, it would be Steve Boyle as well as Kim Jackson, but I don't see them at this point. While we wait for Lisa, do you want to go ahead and get started? She hasn't responded back, and we could probably, start and then kind of fit her in when she jumps on.
Yeah. I will also text Kim, Colleen, and see if she's going to plan on joining us. Okay, so Colleen, I have a pretty limited agenda for today. I basically just copied what you had put into an email about a discussion in regards to updates around the current public health orders, a presentation of testing updates and data in regard to the COVID scenario from Dr. Lisa. So I don't know if you have anything to add in there. And then I just had an update to the Board of Health in regards to the COVID event and recovery efforts. So if you'd like to go ahead and get us started with that, just with like an update of the current public health orders and any information you might have on the testing and data.
Okay, looks like Lisa did just jump on. And so I will say, as far as the public health order, we're not looking to change it at this point in time. Everything that is, that's been able to open on May 1st as well as May 4th. We're still in the works with some applications that are coming in. I'll let Jackie speak to that whole business side and kind of where we're at recovery piece after Lisa's testing piece. And I think, yes, I think let's have Lisa start just in case she does have to jump off, and then I can answer questions, and I have some data to show as well once Lisa's done, and then we'll go to Jackie, and then we'll go from there.
Awesome, sounds great.
Hello, everyone. Sorry, I'm a little behind. Do you want me to go through the slides, Colleen, or do you just want me to give you a 30-second brief introduction?
No, I think it'd be helpful if you went through the slides.
Okay.
And that way folks can see it, and then we can answer any questions from there, and then I can kind of show the symptomatic data against the folks who self-reported against our actual cases.
Great. Okay. And so, I'm sorry. Will I share my screen?
Yes.
Okay. Just pulling up my PowerPoint now.
So while Lisa's getting that up, I will say, as far as the public health order, we have been looking at some of the things that are happening in some of the areas. And Amber, you can jump in here, like knowing that there are kids showing up at the skate park and or at the pump track. And if there's opportunity for the 31st to at least come up with a way that we can say, yes, you can be in these areas with these parameters, and then maybe we're handing out education around that. That is kind of where I feel that it's happening anyway. So we might as well as kind of get control of that in the sense of, all right, we will have some of these pieces, open because they're not, in the public health order, they're not necessarily called out specifically as closed. So I think there might be some options in some of the county facilities, like we talked about the dog park as well, where, social distancing and all of those parameters can be met, then we feel confident that we could safely do that. But on Amber's timeline, Amber's how she wants to go about it, and making sure that we support Amber messaging and things like that.
Great. Can everybody see my screen?
Wait for it. Yes.
Okay. Awesome. All right. So here we go. COVID in Lake County. The first slide is a bunch of squiggly lines, but the red one is the most important one. And what I wanted to demonstrate is the incidence of COVID-like emergency room visits. So if you look there at March 7th, you see an enormous uptick from about 1.5% to 5.5%, and that's what happened to emergency room visits when COVID came to Colorado. If you look at what happened after that, that's in response to all of our social distancing. So we, as Coloradoans, were very effective at social distancing, reducing the amount of transition, and the ER visits decreased significantly during that time. If you look at the average COVID-19 cases in Colorado, you can see that there was that uptake, you know, at the beginning of March when we started testing, but it's been pretty consistent. The little blurb there at April 25th is when Quest opened up IgG testing, which is why there's, you know, a ton of tests during that time. But if you look, it's about 300 to 400 reported cases per day, pretty consistently during our stay-at-home order, which again tells us that it's very effective and that people are getting infected, but getting infected at a rate that does not overwhelm our healthcare system. This next slide shows the cumulative cases, and I put that one in there just to remind us that it's still going up, and it will continue to go up, and it is not going down at any specific point. This next slide is important to the hospitals because it shows us that we have flattened the curve. And so if you look at hospitalization rates for COVID-like illnesses, over the end of April, when we were very careful about the stay-at-home order and social distancing, we have stabilized at about 2,700 or so hospitalizations per day in the state of Colorado, which is very obtainable. If you look at the hospital bed data, it's a little misleading because it counts psychiatric beds, it counts you know, short stay beds, but if you look at, you know, real usable beds in Colorado, there's about 4,000 to 5,000 of them who are capable of taking care of COVID patients. And so at a rate of, you know, less than 3,000, that's very comfortable for us, and it allows us enough space to take care of the patients that we need to take care of. And again, important to remember that this is what happens when people stay at home and are not around one another. These are deaths. So these are people who have died of COVID in Colorado. And again, we saw that enormous, you know, uptick around the middle of April as we were putting, you know, the stay-at-home orders in place. And these, you know, the people who die from COVID die about 2 weeks after exposure. And so these were the people that were dying based upon their exposures that happened in March. So again, just very effective at what happens when people stay home for 6 weeks. So if you look at our Lake County data, here's the raw data. And essentially, I just compiled information from testing here at Rocky Mountain Family Practice and at St. Vincent's. And you can see the dates, and you can see how many cumulative tests that we've done. And this is the first data point of the viral RNA PCR test. And so for those who are not familiar, there are 2 tests for COVID-19. The first test, which is the one that we've had for the longest, is a swab up the nose, or examination of the mucus of your nose. And what that does is it allows for us to determine the genetic material of the virus. So on average, it's a positive for about 10 days during the lifespan of the disease. And so it's a very short window that people get, but it does give us information on who is actively infected, who has the infection right now. And thus far in Colorado, we're testing people who are sick. So when you look at what this gives us, and this is compiled things as of the end of last week, there were 62 patients in Lake County that have been tested, so 62 sick patients. 9 out of the 62 have been positive, so that means 17% of the people that we are seeing in the medical care facility, so either in my office or at the hospital, are sick with COVID. This test is very accurate, so you can't, if the DNA is either there or not, and so the sensitivity and specificity of this test is well above 98%. Questions about that? Okay, so here it is in big red letters. 17% of our sick people have COVID. You know, that means the 83% of our patients who believe that they have COVID actually do not. Here's the raw data for the antibody test between our 2 facilities, and we've done this test. This says 396. There's actually 411 that have been reported so far. So this slide is about 12 hours old. But you can see that 15 out of the 396 people have tested. I'm sorry, there's the 411. The slide is updated, my fault. But 15 out of those 411 tests have been positive for the antibody. And so the antibody is the second test that we have for COVID. And what the antibody test shows is that if you have had enough time from your exposure to mount an immune response. So essentially it takes about 2 weeks from the time that your body sees the virus before it makes these antibodies. And the antibodies can be detected in a blood sample. There has been some very exciting new data over the past couple days where Quest, who has processed the vast majority of these, has increased their sensitivity and specificity in the test. And so when we initially started doing the antibody test, we're all very trepidatious and really weren't sure what it meant. But now we're pretty sure with 98% certainty that if you have a positive test, you have been exposed to COVID-19 and your body's making antibodies to it. So it is helpful in the epidemiological sense that says these are the people that have been exposed. It does not say that you're immune. It does not say that you get to, now be Superman and do whatever you want outside. But it does say that your body has been exposed and you have mounted an immune response to this particular COVID virus that causes COVID, the coronavirus that causes COVID-19. So if you can see, 3.6% of lead millions have been exposed and have IgGs. There is a concept called herd immunity, which means that if 60% of your population has this antibody response, either because of natural disease or vaccination, that your community is pretty safe. So that, measles, for example, as long as you can reach a 60% antibody titer in the population, then people don't really have to be as afraid of measles as they would otherwise. So New York State, after its enormous, medical event that it went through in the past 2 months, has a 15 to 20% positive rate. So what we have learned from this is that one go-round isn't going to be enough to get herd immunity for us. And so it will take years, probably 3 years of repetitive COVID infections for us to reach herd immunity, which means that without a vaccine, we're not going to be able to control this infection for years. And I keep, emphasizing that because that's a really long time. So when we have 3.6% of our population that's affected, and here it is again in big red letters, we're in trouble. And if we were to relax our social distancing too much, and our population here in Lake County gets infected at a much higher rate than we're seeing right now, our medical system is done, and we cannot keep up with the demands of what will happen. And again, right now we're doing great. Right now, we have a buffer. We can keep up with these levels of infections, and everybody will get exposed. Everybody will get infected until the vaccine comes out, hopefully with 2021. But we will all be exposed, and what we need to do as a community is make very thoughtful decisions that allow us to be exposed slowly and carefully so that we can keep up with the medical needs. Because as we all know, if we exceed our medical capabilities to take care of these patients, people will die, not just because of the infection, but they will die because we don't have enough ventilators to take care of them. We don't have enough medical personnel to take care of them. And that's, people dying is awful, of course, but dying because we don't have the medical capabilities to do it because too many people got sick too fast it's horrible. So these are my take-home points. First, I'd like to congratulate, the people of Lake County to say what a great job you've done flattening the curve, because you did it, and you did it very, very well. I'm certainly personally grateful as your physician, but definitely the medical community is very grateful because we've kept people healthy. We've identified the sick people. We've been able to take care of them in a way, and we have not had a death yet in Lake County, which is, very, very. It's important that we recognize recognize what a great job we did. Flattening the curve has happened, and it is it's a huge success from the public health standpoint. We will see rising numbers of cases, and if we are not very careful about how we reopen our economy, we're going to have an enormous wave of very sick people that unfortunately will not survive, and that we are nowhere near herd immunity, and it will take years to get there without a vaccine. Hopefully, as soon as the vaccine comes, we'll be able to change our numbers some. And that, we all recognize, how hard this is on a variety of levels, and that none of us want to be here. Certainly, I would love to be able to participate in my summer events and enjoy Leadville as I have for the past 20-some years. But I don't see a path to that we can do that safely compared to ways that we have, if we were to do the same thing that we did last summer, we're done. So I'm hopeful that our elected officials will take this under advisement and ask me a bunch of questions about how we might be able to do this safely, because I have some opinions about that as well.
Thank you, Lisa. I guess I'm not sure if I have specific questions other than, being curious to perhaps go through a brief exercise, but I don't want to throw the agenda though, to talk about, the May 31st, sorry, of like campgrounds opening or things like that, right? So how comfortable are we that for those items happening? And Colleen and Kaylee, I know you talked to the Forest Service and I did not really get a good update yet. I apologize on what your conversation with them was, but that's kind of the Forest Service deadline, right? So when we look at something like that and opening like low touch facilities, low exposure risk facilities, which I think would be beneficial. I think we can probably do that pretty cautiously. But what's the opinion there on that big piece of the campgrounds, maybe?
If I can just go over the biology just for a quick second. So the virus spreads through respiratory droplets. And so if you are within 6 feet of someone who is just breathing, right, doesn't have to be coughing or sneezing, but just breathing, you are at risk. So if you think inherently how our public spaces work, some are safer than others. The golf course, for example. You can go golfing by yourself, wipe down your cart. You should be fine golfing, right? Because you're not with other people. You take 10 friends with you golfing, that's a problem. Mm-hmm. And so I think when you begin to consider opening up these venues, you have to determine how you're going to bring out the message. And I know that Colleen's been thinking a lot about how to message these things. But the most important thing is that if you're going to open up the campground, make sure that they're individual sites that are spread far apart from one another, that you do not have a communal sink, that you do not have a communal cooking area, that there are places where people go to be able to be alone. And if you can figure that out in an outdoor venue, I think that you can do this safely.
Yeah, I think, Sarah, so much is going to come down to education and what people are willing, how responsible, right? People are going to be in the sense of, their own responsibility of, how they follow, whatever that social distancing looks like, which it's not going to change. Like we talked about, that's the new normal, 6 feet apart, cloth covering in public, that kind of thing. I think what's really hard for us as we start to see other counties, what's the right word? Cave to pressure, right? Economically, in the sense of, I now know that Chaffey County, as well as Fremont County, as well as Gunnison County, are now looking at a couple of different variances to, open some of those businesses like restaurants prior to June 1st, if you will. And granted, the governor might come out with something in another week to say, hey, I feel comfortable. Most of those variances are looking at like asking for those businesses to open at 30%. I think, you know, I'm still not comfortable with that at this point. I think for us, the longer that we can hold folks out, the better, and then be prepared. And so kind of doing all that work behind the scenes, and I'll let Jackie talk, you know, about that piece as far as, you know, as far as the business and what those protocols are looking like, and what our feel is at this point in time. But I think we're not going to have the ability to hold back that storm post June 1st. I think people have been holding on tight for, you know, so long, trying to do the right thing. But, you know, the restaurants are going to want to open, the hotels are going to want to open, you know, the campgrounds are going to open, it seems like, from the Fire Service at this point in time. And so it doesn't seem, you know, reasonable in the sense of if you know, the Fire Service is making the decision, the campgrounds are open, that we wouldn't allow like our hotels and motels, you know, obviously to open as well. And I think so much of this in the next couple of weeks, and big point of mine is exactly what Lisa spoke about, was, you know, what that messaging is, how, you know, what those protocols are in place to ensure, you know, the best possible safety, and people to recognize, hey, you're in our town, but we are following social distancing protocols, even if you're out and about. Like, we, you know, want you to wear a cloth covering, you know, over your face. And so that's information we can push out through our different hotels and through our short-term rentals to say, hey, be prepared to do this. This isn't like you're coming back in and it's, you know, no holds barred, if you will. And so I think that's kind of where I'm at. As much as I'd like to keep it all closed, I still feel very strongly about special events not happening, in the sense of, we already know, and I mean, just from this weekend alone, if anybody, you know, was just happened to be out driving, you know, how many folks were coming through, how many folks are doing dispersed camping, you know, already in our county, that I think if we can get the message out and just push it out, and continue to push it out, then I think, you know, we will see some openings come June 1st, but I am not looking to do anything prior to that. Obviously, we'll see what the governor says, but as you can see, the numbers that Lisa's presenting, like, we just don't have a lot of affected folks, like, surprisingly, right? In the sense of, this is why you collect data, this is why you look at these things. And I was going to pull up something on my screen, but just to show just the overlay of people who are self-reporting are following the same trend of folks that have actually tested positive, in the sense of, you know, where some of those spikes are. And at this point in time, we're starting to climb again, you know, because we've increased testing, right? That's just the norm of it. But so that's kind of where I'm at overall. I don't know if that kind of helps or doesn't help, or you know, kind of a thing. So,
well, I think for me, the helpful comment was, I mean, I don't ask that question not having thought about it and having our own conversations, right? So I'm well aware, and I've been thinking too of, you know, what levels and stages and openings. I'm surprised, honestly, to hear you say that we won't be able to keep short-term rentals closed if the campgrounds are open. I am not, I make this statement not necessarily advocating for one or the other, but I do think that, you know, campgrounds opening opens the level of tourism, Summit and Eagle releasing, it's such a set, not really reopening, or I'm sorry, you know, and our commuters going back and forth at a higher rate. That's another level of risk. And I think we can, like, name 1, 2, and a few others that we maybe should stop at, and then see, you know, what the pace of exposure and the effects of health are in our community. So again, I'm sorry. I think I heard you say that campgrounds, you know, you expect that we can mitigate through campgrounds opening and certain facilities opening, which I would currently agree with. And honestly, I you know, I mean, I guess there's more, you know, to get those lists down of short-term rentals, lodging, and other things that are pressure. I certainly, I mean, the restaurants opening, I don't personally right now, it's not even in my head to open that kind of environment. And I think, well, one, because I think if you open the campgrounds and you're actually getting some tourism, hopefully that's a boost to their business. And they see a benefit with that action and activity happening.
And so remember, restaurants are currently able to do takeout and delivery, and that will continue. The restaurants just right now are not able to do dine-in options. There are other communities across Colorado that are in my opinion, jumping the gun, and they are essentially the guinea pigs here and trying to open the restaurants and see how it's going to work. And we might see that it was a knee-jerk reaction and they will be quickly closing their dine-in options. I kind of anticipate that might happen in some of those counties. As far as businesses that have been applying to us to open, we've received 39 applications. 26 of those have been approved. We've got 5 that are pending June 1st. And that's because part of their facilities can open now, but part of their facilities or their services just need to remain closed, like similar to the restaurants, no dine-in until possibly the next public health order, which at this point we still don't know what that looks like, but it would be after June 1st, whatever that turns over to. Let's see, there are a couple of other applications that are still being reviewed today, but look like they'll probably be processed and approved. There are probably still businesses out there that can submit. There's no deadline. They can submit and we'll process them as quickly as possible. And if their social distancing protocol looks good and in line with the state guidance, then we are issuing those letters saying that they are approved to operate under the conditions that they've applied.
Jackie, this is Kayla. Sorry, I'm also being summoned for a snack. Can you and Colleen kind of walk through for us, because I know that we have some Board of Health members on now as well, kind of how you're assessing those applications? Are you giving them individualized plans, or are there plans in place according to the industry that they're in and the services that they're offering, or how are those being addressed?
Right, so every business has to submit the social distancing protocol submission form, either via PDF, fax, mail, email, or there's an online submission Google Doc form that feeds into an Excel spreadsheet that we are reviewing. Every business, we've got a protocol that we are reviewing based off the state guidance. So each facility is tiered into what type of business they are. If they're retail food, if they are an office business, if they are a medical center, and then if it's retail sales type. There's different guidance documents for each, and we're allowing the businesses to submit their plan that they feel is best fit for their services. We're reviewing just to make sure that they are adhering to the state guidance. So if the state says they are required to have a mask and gloves on, then those employees need to have masks and gloves on. If their facility is doing something low risk and gloves aren't necessary, then as we review that, we're not enforcing gloves. So that's kind of the basic, what we are looking for, documenting and then giving the approval. Did that answer that question?
Yes. One of the other questions that we had come up with some conversation. It's okay, sweet pea. With the EDC was okay. Here. Okay, I got your Peppa. There's a shortage of PPE. So are you able to give those businesses that are looking to start a phased reopening any resources for PPE?
No, we can give them resources for where they can either make their own cloth masks or find alternative methods for some of their protocols. Example, using a tool like spatulas to pick things up, similar to how we normally handle retail food safety protocols for whether or not they can use gloves or not. So we are trying to work on a case-by-case scenario with those business operators and trying to adapt their plans as necessary. But no, we do not have any cache of PPE to be giving out to businesses. They are on their own trying to obtain that and properly either protect their employees or have their employees come to work with their own proper PPE as necessary.
Okay, I think that might be the only question I have right now for that.
Okay.
So I just have another clarifying question as well in regards to the public health order and the phased reopening. I just think it might be helpful for us, or at least for me, to understand what, and Lisa, you might be helpful to answer this as well. What type of data do we look at to determine the phases of reopening?
So the graphs that I showed before, the flattening of the curve. And so what we look at is percent infection and what the prevalence of the illness is. And so if we can get to 60% antibody titers, either through vaccine or through natural infection, then that's a carte blanche. We open up everything and off we go. We want to look at a percentage increase about where we are now. So 3% per week or 3% per period of time would be safe for us. We would not run out of medical facilities to be able to take care of patients. And so if you look what 3% from my graph represented, that's essentially the amount of infection that we can tolerate per week. And so ongoing data. So one of the other, the caveat to that is we have to continue to encourage people to still come in and get tested so that we know where we stand. And even if you had a negative test last month, please come in and let's do it again and see if you have a positive test now, because that data will be helpful also.
And Kayla, for me, I am looking at that criteria that we shared from CalFO as far as, looking at that data piece. And so it is, I'm just going to read them again, like a sustained decrease in cases for at least 14 days. Hospitals are safely able to treat patients without resorting to crisis standards of care. Testing can be performed for all people with symptoms consistent with COVID-19 infection. Active monitoring can be accomplished for all COVID-19 cases and their contacts, and clear protocol in place that requires social distancing and assists with case identification. So we're doing pretty well overall. We don't have a sustained decrease at this point in time. We are at a good level where our hospitals can handle it. We have been able to open up testing for all symptomatic folks. At this point in time, public health has been able to actively monitor, everyone who's positive and their contacts. And I feel that we do have a clear protocol in place that requires social distancing, and then we'll just continue to build on that as far as campaign goes. But, even with that said, that kind of just lets us in, you've heard me say, like, crack that door open and look at some of these smaller pieces that we're allowing to happen and going from there. And I can resend this document, but basically, obviously everything we're going to be doing is operating with social distance protocol in place.
Colleen, oh, go ahead, Kim.
Are you sure? Thank you. I'm sorry, it took me a while to get on, so you may have answered this question already. But the short-term rentals, currently within the city, when people are reaching out, they have to have the license to be able to house essential workers. And but I'm kind of wondering, because I was sent the state public health order, which said that hotels were critical businesses, or no, it's like not hotels and places of accommodation, excluding private short-term vacation style rentals. So in the state order, it looks like it says that no short-term rentals can be occupied except offered for use for the public health response. And, you know, we have people looking for housing and short-term rentals that are, you know, coming into town for construction work and things like that. Are they considered in that exception to the public health response?
So there's two things there. So reading from the state public health order, we have the ability to be stricter than the governor's order,
Okay.
which we are. So that's why like we don't have hotels, motels, and things like that open, as well as short-term rentals. And in our public health order, our local public health order, we do have those exceptions for, you know, any one of those businesses to rent out to anyone who is doing any kind of work here, and recognizing. And I think when we pushed out the new order, we were very clear about like, hey, like anyone, and you can make a new reservation for any local worker that's coming into town. So we did put that wording in to clarify that further. So yes, short-term rentals, as well as hotels, motels, can accept new reservations currently for anyone who's working or, you know, who's coming into work. Because we know there's a bunch of projects that are coming up, you know, from, you know, like Excel to the paving to the stoplight to like the rail yard to everything else. So they are able to, you know, rent at this time for folks locally working.
Okay, it's not just them being able to stay in the hotels or those kind of lodging facilities.
No, they can do short-term rentals as well. That's part
Okay.
of the exemption that we have in our local public health order.
Okay. I did receive a call the other day from a woman who was planning on coming and getting married in May, and her short-term in Twin Lakes, and her short-term rental had not, at this point, had said that they're allowed to keep any of the reservations that they had made. They just aren't allowed to take new reservations. So just to give you the heads up.
Yeah, that's actually super inaccurate in the sense of they should have been emptied since March, and they haven't been able to reopen other than taking, you know, reservations for anyone coming in for work. So I guess we'll have to figure that out. And maybe they already got married. I don't know.
Colleen, I also had a question about some of those workers for CDOT and XL coming in who have RVs and are looking to or currently have reservations with their RVs. Maybe a more in-depth conversation outside this meeting, but
I mean, technically, right, they're coming in, that is allowable.
right. But yeah, sorry, just the places where they have reservations and they can hook up may need more communication.
Okay,
Let's
nope,
just
that's
say
good to know.
Okay.
Yeah, and that can be, you know, obviously you can direct any of those, you know, hey, we think we need to have a conversations with different businesses, and we totally have that capacity. And okay, sorry. I was just looking from Ann, she was talking to Kim, but it came out to everyone, more information on the short-term rentals, if you will. So we can follow up.
Colleen, I'm sorry if it's just me confused by a statement you made or the information being presented. And then I think what you had said was based on neighboring counties' efforts to open up, you don't think that we will be able to prevent certain uses from happening? Can you clarify that for me?
Yeah, I think, you know, as we see other counties around us, like even if they hold kind of to the exact same thing, because, you know, ironically, we all went in this like, hey, we're going to hold all of our, you know, businesses, all not the ones that we knew that could open on May 1st and or May 4th, but in the sense of like our lodging, our, you know, restaurants. And now there's a lot of pressure to open those prior to when they actually feel comfortable in that respect as a public health agency. And so like, I will first and foremost say, I absolutely appreciate the support that we're getting, that we're not, you know, pushing to be like, you know, forget the data, forget everything. We just have to open, if you will. And so my point is, I don't think we have the ability in Lake County, like, right, if I had my choice, like really, if I had my choice, like, I keep us in lockdown all the way through until we get a vaccine, right? That would be like the most ideal public health situation, but we can't do that for folks. And if we have other tourists flowing in between, here and there, and we're not allowing our, hotels to reopen, when campgrounds are open, I think that's my point, is I feel like we can only hold folks back before they will just do it anyway, before they will not comply anymore. And I'd rather have them hold and comply with the social distancing that will come out to give to the hotels and say, hey, this is what we need. This is what we expect for cleaning. This is what, for you to open, your social distancing protocol has to include these recommendations, and guidelines from the state, so that we can do it where they feel comfortable that they'll be poised and ready and to open appropriately, versus like, forget it, and we're just going to get reports that, oh, by the way, these guys already opened, these guys already opened, these guys already opened, versus, hey, we hold till June, please, and then can we now, look at all the social distancing protocols and have folks poised and ready. I think that's kind of where I'm at, in the sense of, as much as, like I said, like to keep it shut down and lock her down, I don't think that's feasible, and I'd rather do this in a way that we feel that we've given everyone and provided all the education so they can open as responsible as possible. And then in the end, it's always going to come down to a person's responsibility of how they interact in public, where they go, what they do, kind of a thing. And so that's both in that respect.
So are some of those businesses that you referred to just waiting for that June 1 date, are those ones that aren't currently eligible for the phased reopening, but you've been working with to plan new operations for implementation?
So if you're referring to the ones that I said, we have got 5 pending through June 1st.
Yeah.
Part of their facilities can open. So for example, facility
Just not
has
to-
partial retail and partial office that can open now. But then they have a entertainment venue that needs to remain closed through June 1st. That entertainment side then can be reassessed. They can submit those plans now, and we can review them and say, this looks like you'll be prepared for the next phase reopening, which could be June 1st. But in the meantime, they can open limited to their retail and to their office space.
I have one more question. This was in regards to what Lisa said about being able to open up those parks and the campgrounds, and really needing to be able to have facilities, separate facilities. How would that work with the restrooms? I guess that would be my concern.
Some of the guidance that we've been seeing around the state is if they are campers that are coming in with their own RV camper that has a toilet facility in it, that's ideal. If they are camping out in the forest in a place that they can cat hole and there are no public facilities, that's, I guess, the next choice. Campgrounds that have those public restrooms, essentially, I believe the Forest Service was saying that they were going to keep those closed a little bit longer. But if they're opening them, then that's where the public needs to be educated that it's their ultimate responsibility to be hand washing and protecting their own family members from potentially spreading or getting exposed to the illnesses and the germs that we spread in restroom facilities.
Kim, were you asking about restaurants or campgrounds? I'm sorry. I don't think I heard your full question.
Yeah, I was asking about the campgrounds and the restrooms, just because, I've just noticed that the places that do have restrooms open now is definitely where people are, going to do their hikes and stuff like that. Like I was out at Hayden Meadows the other day and there was quite a few people there just stopping to use the restroom. So it just made me think of opening up the campgrounds and that aspect of it.
Yeah, I think, Kim, like that, a lot of that's going to come down to, right, like responsibility of, what do you have available to yourself to protect yourself in the scheme of it all. There's going to be a lot of like use at your own risk, like even some of the signage, some of our trailheads right now, knowing that we have a decreased responsibility to respond. And we want people to be much safer out there instead of like, hey, you just used up one rescue, just took all of our resources out of, the county, if you will, for hours. And so, there might be, signage and things like that. And I think that's going to be, so much is going to be falling onto people and their own personal decisions of how they're going to manage some of these situations.
I have just a couple quick questions, Colleen. So with surrounding counties opening around us and more of those commuters potentially going back into the workforce, what is the anticipated windfall of that for us?
Do you mean in the sense of like when we might see more infections in that respect of, as we know right now, the window is usually, is a 14-day period. Most folks getting sick between, 2 and 5 days. And so I think that will be, very telling. But the reality is that folks who are going back into this workforce should be doing so safely in social distancing. It's not like that is changed, across the counties. That's universal across the counties. So, the protections that are being put in place by these employers, are going to be inherent on what it looks like for, any one of us.
Right. Well, I just am curious about that because we have such a huge population that commutes, and I don't know if we have data out there available to say, of the 70% that commutes daily out of the county for work, 40% of those were considered essential and continued to commute through the stay-at-home order. Or how, do we have any data around those numbers so that we can say, just as an example, like 40% of those 72 were considered essential, and now we're up to 65% of that 72% that is going back into the workforce. So that additional 20%, we should expect an increase of XYZ cases. Do you have any data around that at all?
No, because I don't think we actually have good data. We just know folks travel, over the hill, but we don't actually know where they work, what businesses they're doing. Like, I don't think we have that dissected out in any survey that we've done that I'm aware of. And I mean, we being like the county as a whole, from EDC to public health to bill generation to, to actually say this is hospitality, this is, healthcare. And I could be wrong, I can check, but I don't know that we've ever had that information. So we definitely aren't collecting it at this point in time either. I think it would be interesting knowing, maybe there's a ridership thing at Eco Transit to say, hey, during this time we've had a decrease, or hey, we haven't had any change in our ridership. And, that could be, a piece of the puzzle, but I don't know that I'm going to go out there and do that piece. I don't know who would be assigned that piece if that's something we're looking for.
Okay. And then Lisa, you might be able to help with this question a little bit. I know that we do have the antibody testing, but like for myself, I have had basically minimal contact with anybody since maybe mid-March. And so I would not think to go get any antibody testing, even though my husband is a commuter and he's basically all over the place. Would it be valuable for us to market that antibody testing, or do you think people should go get the antibody testing just to get it, so that we have that data, or what's kind of the protocol?
Yeah, we would love to have 200 people per week in both of the facilities be tested to be certain that we're continuing to have good numbers with which to estimate what's happening. So right now, what we've done is just send it out via email blasts. We're advertising in the newspapers on both online and in print, in an effort to just let people know that it's here. And we've had a good response. We've just had enough public interest that we've had a large variety of people from multiple demographics come in to get the testing done. And we're just hopeful that that will continue to happen. And so through these venues, as we meet weekly, we'll continue to talk about that. And if we need help getting more people in, then we certainly will. But right now, what we're asking is that people who are interested come in, and I will hope again, and I tell people as they get their results, that even though you're negative today, Next week you may not be. So we just need to keep a good contact with all of our folks individually to make sure that everyone gets tested as they need to. And remember, it is a free test now for everybody. The only population that we can't do the antibody test for is people without Social Security numbers without insurance. And so if you, that's the only test that is not free. Everybody else has free testing.
So this is Kim real quick. I just wanted to, first off, me as an employee of the city, I know the city is really trying to, get back open, so that we can provide our services. And it was a little bit anxiety, was there for me. And, but I went and got the antibody test done today. And I thought I would maybe have to pay my copay, and that was also covered. So when you say it was free, it was really free. So,
really free.
Yeah.
But
that kind of brings me to the question of opening up these businesses. Is that part of the requirement? Or they, do employees should be encouraged to go and take these tests before they get back into the workforce and start working from, the office?
you have to remember that this test does not show you if you're immune or not. This is academic at this point, in an effort to try and figure out what kind of prevalence we have. And so even though you have antibodies to this thing, we have no idea if you're immune to it. So you could certainly get it again, which is our risk, which is our worry. And we definitely know that when COVID 2020 comes, or COVID 21, or COVID 22, as this thing continues to circulate the planet, 1 year's immunity does not give you immunity for another year. So it's academic now, right? And what we need is information to be able to tell our community how many people have been exposed and how many people are going to, we can't be overwhelmed. And so, get back to Kayla's question about, the concerns about bringing too many people here is you have to remember, that if we get 2 critical patients here in Leadville, we have overwhelmed our medical system to take care of them in our hospital. And that, families come up to go camping, they come from elsewhere, and they come and they're sleeping in their tent and they get sick, and there are 6 of them. This happened in Summit County 2 weekends ago, where there was a family that came up, and one died on the way to the hospital, the other one died in the hospital, and 4 of them were able to be intubated and taken to Denver, and they're still alive. But it's just sheer numbers, and that when you come to a rural place, even if you are alone in your tent in the middle of nowhere with 6 of your family members, if you brought the coronavirus with you and all of you get sick, we're done. We can't save you. And that's the bottom line behind all of this.
Lisa or Colleen, do we know for a fact the Forest Service is opening up its campgrounds in June 1?
I don't think it's a fact yet. I think that's where they're at because, right, it runs out on May 31st. And I will just say that I will be surprised that they extend it because of the fact. And this is something that's coming up in Gunnison because the state parks, like the boat ramps are all opening and the lakes are all opening. They're like, well, we don't want people then like all over the place if we can contain them like at the lake, at the campground. We want those campgrounds to open. And I think that's going to be similar to what that argument might be for, even our county or other counties across like the forest, if you will.
So you think our boat ramps and our campgrounds will open?
So the boat ramps are, I think, Clear Creek, or that's Chafee, but still, I think they are slated to open here within the next week. I'll have to double check that.
Yeah, because I know that the Forest Service said that they're going to keep all of that closed at least until May 31st. All
right, well maybe I'll have to see what forest Gunnison, like I know I always get confused like where the line is, but I just know that their boat ramps are opening in the next 2 weeks, and so they're trying to now align their camping opening, in those like Blue Mesa, right? That's a big one down there, and it's got a lot of camping, and so we felt the need to like, hey, we got to get those campgrounds open because we just don't want it to be, all of these folks now in town versus staying, isolated in their spot, boating, camping kind of thing. So. As you know, it continues to evolve, but I can double check that for sure.
And Dr. Lisa, are you going to present that slide tomorrow at our referral agency meeting?
Yes, sir.
Okay, very good.
I just have, and I'm sorry, I think I missed this at the beginning of the meeting in talking about your conversations with Amber about facilities and rec programming. Can you just touch on that a little bit for me? Because I just caught the tail end of that, and if you could just update me a little bit before we go.
Yeah, absolutely, Kayla. So the conversation that we were having is, we're recognizing like the golf course can open. We recognize that people are coming into the skate park. They're, at the pump track. The dog park is currently closed, but if we have the ability, but prior to May 31st, to look at some of those spaces, and Amber, I apologize, I have to set up a meeting with her tomorrow, is the plan, kind of walk through what we think would be, that would still be within the safer at home public health order, not violating it, and then having the ability to push out messaging and signage around, how they can recreate in those spaces safely or safer. I don't know if that's the right way to say it. And so we haven't talked about programming prior to June 1st. We were only talking about some of the spaces that people are already in. And if we can kind of get ahead of that to say, okay, great, you're in here, but this is how we want you to use that space. That, that includes like the dog park as well. And I think those were the three main places, but then we need to have conversations with, the Moto Park, which is a private, club where, hey, can they do that well? Can they social distancing well? And that's definitely not that's not captured in the public health order, if you will. And so, we want to make sure if we're going to do this, let's do it well, let's do it organized, and so that people know and have the same information across the board.
Perfect, thank you.
Mm-hmm.
And I would imagine that you're having a conversation with her around the opening of the facilities tomorrow, right?
Yes, of some of those outdoor spaces.
Okay.
Yes.
And
yes.
then will you also share that information with us so that we're aware of what your timeline and planning is for that, or what the expectations are at those locations as well?
Absolutely. I think that's basically, hey, let's come up with a plan and let's push it. Obviously, we wouldn't push it out without going through, and we'll include like the Board of Health in there as well. I apologize. I feel like I loop you in that I don't, but I was like, I'm making sure going forward that I have you guys recognizing all the lingo and the language that's happening. But yes, we'll push it through all of you guys so that say, hey, this makes sense. We feel comfortable with it, and then we can go forward with that.
Okay, cool. Thank you. Sure, I can help you.
And then I missed it at the beginning too. Are you anticipating short-term rentals being open on that June 1st date too?
At this point in time, that's where we're at. Obviously, anything can change in the next 2 weeks.
Okay.
And but at this point in time, I think that's what's going to happen.
Okay. The city's in this position where most of the short-term rentals have not gotten their licensing yet. And so I'm just under a lot of pressure from the short-term rentals to get their applications processed. and so it's just good to have the heads up that June 1 is going to be the date that they are.
Right. And then obviously, Kim, anything can change like in the next 2 weeks. We get a spike and, we can have, chaos all the way across the state, and then everyone's locked down again. Like it's just.
Yeah, I'm not sure.
That's what we're shooting for. Best case scenario, that's what we're shooting for.
Okay.
Yeah.
Yeah.
I was just gonna say, I'm not sure I'm comfortable throwing that out there in certainty right now, but
I appreciate that from an administrative point of view too. So yeah. Anyhow, thank you.
I do want to just say I definitely having conversations with a lot of folks that support the opening of those facilities, that we can keep social distancing and protocols in place. I think it'll be great to have those options for locals and people to go out and add to kind of their repertoire of staying sane. So
Absolutely.
Thank you.
All right, are we done? Because most of us need to jump on the EOC meeting that started 5 minutes ago.
Yeah, I think so. I think Commissioner Glenn, do you have any additional questions at this point?
No, I don't have anything.
Okay. I think we're pretty good. So we will reconvene next Tuesday at a work session and if we have some data or something, we'll just touch base before then, Colleen.
Absolutely, yes.
Sounds good. All right, thanks
Thank
everybody.
you.